One of the things I thought about and thinking about developing what we're going to talk about today is bronchopulmonary dysplasia, right? And so we all know, and for you guys out there, when you are conceived and now you're a dividing cell within the inside of your mother, organs develop kind of at different rates. The lung starts developing in about 3 weeks, 3 to 6 weeks, and the cells start to divide, and then they start to separate out the different aspects of the lung and architecture and all of that. But that process of the lung development takes place over the course from that 3 weeks to like 36, 37 weeks. I myself was like 2, 3 months premature. And so when I'm reading about bronchopulmonary dysplasia and the development of the lung, I'm like, man, I got that shit. Like, what's wrong with me? Like, maybe that's why I can't breathe and I'm running fast sometimes. But it seems to me that like there's a lot of kids that are born premature these days. BPD has got to be common. And I'm sitting here wondering, like, it's fascinating to me that there's a lot of individuals that are completely fine, but it seems like every premature kid is going to have some element of BPD. Is that the case?
Children born younger and younger are surviving that, but their risk for the BPD does increase the younger they are. Many children do well, but we know in general across the board they're at higher risk for developing asthma. So they may leave the NICU or the nursery doing okay, and then they may show up in my office at 3, 4 years of age because of exercise-induced, shortness of breath or chest pain or that type of thing, which ultimately will end up being asthma.
And are you screening for that in your office? Do you do, again, I don't know, do pediatricians do spirometry or lung volumes every so often? How does that work?
Some do.
Yeah.
My personal practice does not have pulmonary function testing, spirometry, even using the old-fashioned, forced FEV1, forced volume to try to assess asthma. We don't really do that. We go more based on physical exam findings, pulse oximetry, see how they're oxygenating. But, speaking to those babies with lung injury or immature lungs, I think it's amazing how things continue to develop and heal when kids are young. Just like we talk about other injuries that kids have, whether it's a laceration or a brain injury, they actually, depending on the severity of the injury, so many of them do remarkably and surprisingly well and recover without anybody knowing that there was that serious injury. And I think the lungs are similar. Like, they can withstand pretty significant injury, whether it's infection or pneumothorax or premature birth without enough surfactant, and they do incredibly well with the medicines and over time. So we see this like healing of the lungs, which they probably don't have normal lungs. Maybe you don't have completely normal lungs.
Yeah, probably not.
But on the surface, you're mostly not going to have problems unless you're really pushing yourself to the extremes, maybe, is how it usually goes as an outpatient. There are those kids that have very severe chronic lung disease because of their initial injuries during prematurity or whatever their underlying problem was.